Thank you, Mandy. So my name is Luke Sammut. I'm one of the registrar doctors in Portsmouth. And first of all, I'd like to say a big well done to all the team involved, Mandy, Colin, Janice, and everyone for this conference. I'm honestly impressed. So it's my first time here in this osteoporosis conference, and I'm going to talk on osteoporosis, giving a little bit of a background and its relationship with men and general health. All right. So as an introduction, until about 10, 20 years ago, no one really knew that osteoporosis could also affect men. So before we thought it was just a condition that affects women. But that's not true. So it's not a condition that affects women only. We know that it also affects men as well. So, but how common is osteoporosis in men? And do we really need to care much about osteoporosis in men? So the answer is obviously yes. Fractures caused by osteoporosis, so weakening of the bones, happen in 1 in 5 men. But why do we really need to care much about osteoporosis in men? So I'm going to really explain a little bit what happens and why men also can have osteoporosis. So when it comes to women, so females, we know about the menopause. So that occurs about 50 years of age. There's a drop in their hormones. So that leads to a decline in their bone strength, isn't it? So if I show you a little bit the graph. So it's very simple. So the red line is the women's bone strength, and that goes down roughly around this bit, isn't it, when they reach about 50 years of age. The yellow line is men, and what happens is around 50, it's still pretty good, isn't it? So compared to females. So men haven't got a menopause, but they have another hormone that is linked with bone strength, and that is testosterone. So what happens is that later on in life, us men, we lose testosterone. It gradually declines. So with that decline, there is still a decline in bone strength. And although there is a menopause in men, there is still a decline in bone strength because of, well, one of the factors is testosterone. So osteoporosis happens in men, but it occurs more later in life. So about between 60 and 70. And by that time, the rate of decline in bone strength is similar to women. All right? So again, it's the same as women. The fractures mostly involved are the same. So the wrist, the spine, and the hips. So it occurs less frequent than in women, so about 20%, so 1 in 5, but still significant. So those are the numbers comparing men and women. And yes, they are smaller, but still significant. And why is it significant enough? And I'm going to talk a little bit of why it's important to talk about osteoporosis in men as well. So not only osteoporosis in men is common, but there's a higher mortality linked with osteoporosis in men. So men are more likely to drop dead if they have a fracture linked with osteoporosis. So if we look at the red, so the red ones are more, so men. So the red one is men, and the yellow ones are women, and these are the types of fractures. But you can see that the mortality is higher in men. Okay, so what about the morbidity? So what about the quality of life in men after having osteoporotic fractures? So about 50%, they are after hip fracture, they were discharged to a care home or a nursing home. And only 20% went back to their home living independently without any sort of forms of care. So pretty impressive. So this is a bit of a summary of what we've already discussed. And I'm going to talk a little bit now more on how to maybe prevent osteoporosis and tell us a bit more about men's health. So what we've said is that osteoporosis in men is linked to a poorer quality of life and loss of independence. The lifetime risk of having a fracture in men is more than prostate cancer. 1/3 of hip fractures worldwide occur in men. more men compared to women are likely to suffer serious consequences and death as well. And if it happens in the younger age group between 50 and 60, then there's a loss of productivity and work. So, am I at risk of having osteoporosis? And these are actually almost the same as women. So we know about the personal factors, the medical conditions, medications, and also lifestyle issues. So in terms of men, I've already spoken a little bit about testosterone. So that is one test that we normally, that we might try and check if we are checking for osteoporosis in men, because a lower testosterone is linked with a higher risk of osteoporosis. But again, so the personal risk factors, so yes, if you have a family history or if you've had a fracture already with osteoporosis, then you have a higher risk of having another fracture or osteoporosis. The medical conditions, so chronic liver conditions and kidney disease, if you cannot absorb calcium and vitamin D in your body, then you have a higher risk. And also in our condition, there's rheumatoid arthritis as well. Medications, specifically for men, if they are treated, most of the treatments for prostate cancer lower the testosterone, so that's more linked with osteoporosis. We don't like giving steroids because one of the things is osteoporosis, so that is linked, that's on there as well. And some anti-epilepsy and some antidepressants are also associated. There's a risk with osteoporosis. Lifestyle issues, which I'll go a little bit more in depth, and Colin also mentioned that in the previous presentation. So smoking, alcohol, being overweight or underweight are linked with osteoporosis, and also physical inactivity. So identifying the risk factors, most of the time actually, unfortunately, we don't find any risk factors in men. So about 40 to 50%, there wouldn't be any risk factors that we can check or we can identify. But quite a significant proportion are secondary to perhaps cancers and steroid tablets, and again, as I said previously, sort of alcohol and the lifestyle risk as well. So I mentioned testosterone and osteoporosis because it's one of the factors in men. And it maintains healthy bones and muscles. So with a reduction in testosterone, there's a more of a higher risk. So one of the things that perhaps you can check is if you are getting shorter. This is a general guideline. It's not something specific or set in stone, but one of the things that can be easily sort of mentioned is that if you feel that you are getting shorter, roughly, I mean, there's 3 centimeters in the slide, but if your bones are getting weaker, then you will get shorter. So that's one thing that you can check. Okay, so 5 steps to better bone health, and actually Colin mentioned quite a few of these. So we want you to take charge of your health, isn't it? We want you to be independent for long periods of time and to enjoy life as much as you can. We don't want you to have a fracture, and perhaps identifying your risk factors, you can lower your risk of one, having osteoporosis, and two, having a fracture secondary to osteoporosis, which we don't want, isn't it? So yeah, what are the 5 things? So one of the things is regular physical activity. So don't just do physical activity purely for osteoporosis. We know it's better for your general health, isn't it? For your better well-being, your cardiovascular system, your heart, your lungs, and also for the social aspect if you exercise with someone. I know there's a presentation on physical activity a bit later on, but the key thing about physical activity in terms of osteoporosis, we want there to be a little bit of an impact on your bones. So weight-bearing physical activity is the one that we would normally advise. So if you like swimming, well and good, continue swimming, but if you could add a little bit of walking, going up and down stairs, so those are some pictures there. So jogging, hiking, walking, skip ropes, and yes, if you like racket sports like tennis or badminton and dance, well and good, yes. That's good for your bones. So yeah, that's one of the key things. So bone health and nutrients. So in terms of diet, maintenance of calcium and vitamin D is important. Unfortunately, there's very sunshine in this country, so vitamin D, which normally is activated by sunshine, is a little bit lacking. But you can get some from egg yolk and salmon and tuna, which can help. Calcium we know, so yogurts, milk and cheese, and yeah, so all important to try and maintain a healthy diet and to try and maintain your bones. And if they are low, we normally replacement with obviously supplements, but at least you can try and help yourself with eating healthily. That always helps, sort of, definitely. So 3 things. So smoking, and in fact we had a chat yesterday with Mandy that smoking is toxic for your bones. So try and stop smoking and get help to stop. Alcohol. Too much is always bad for your health, so we normally advise to limit your alcohol and wine and beer to as much as you can, and maintain a healthy weight. So being underweight is also bad for your health and your osteoporosis, and being overweight isn't ideal as well. So being at the right weight is ideal. So smoking increases your risk of breaking a bone by 29% and suffering a hip fracture by 68%, so very high numbers. Okay, so identifying your risk factors, and this might sort of, I'm talking more from a man perspective. So we know females are more likely to talk to their doctor when it comes to osteoporosis and their general health. But for many reasons, men don't feel that they need to speak to their doctor. So I do encourage everyone that if they know that they are at risk, go and have a chat with someone to get advice and be tested, perhaps. So men are between 20 and 25% less likely than a woman to visit a doctor. And I came across this from a Men's Health magazine. That women have a much more healthier relationship with their body, but men treat their bodies a bit like a car. So once it's burned out, they'll fix it, but until then they will power on. So I found that quite good actually, and yeah. So yes, so the last point is that yes, if we advise taking osteoporotic medication, we do it for a reason. And we have to outweigh the risks and the benefits. So you might not feel better if you're having medication for osteoporosis, but we know that if you take them, it's like an investment for your bone health. So that's why I put this slide here, because you might not feel in yourself better on the treatment if you need them, but it is sort of see it like an investment for your bones. So it's very important that you take the treatment prescribed if it is indicated. So that's why we have a fracture liaison service to try and reduce your risk of having more fractures in the future, and identifying your risk factors so that you have a better quality of life. And I'll just sort of give you a little bit of a summary what we've mentioned. So male osteoporosis is common. But it is a challenge, especially with the risk factors and identifying it as well. There's a high morbidity and mortality, which is very significant, and perhaps more when it comes to males. One of the reasons being is that males develop osteoporosis later on in life, and maybe they have more comorbidities when they have fractures. We try and identify the risks, but sometimes it isn't easy as compared to females, so it is a challenge. And we spoke a bit about the lifestyle measures. We have got treatments for osteoporosis in men, and they are similar to females, so it's the same. And yeah, I can conclude here, and thank you everyone for listening, and yeah.